Good evening to all. Good evening to all. I hope I am audible to you. Good evening to all. I hope I am audible to you. Good evening to all. I hope I am audible to you. Good evening to all. I hope I am audible to you. Good evening to all. I hope I am audible to you. Good evening to all. I hope I am audible to you. Good evening to all. I hope I am audible to you. So we was discussing about the depression, right? So yesterday I have started your depression. Depression is nothing but the affective disorder of brain, and that is due to the unavailability of monoamines or known as a biogenic amines, particularly your noradrenaline, serotonin, and up to some extent dopamine. So due to the depletion of brain's catecholamines, there is depression. So drug used in the depression known as antidepressants or psychoanalytics or mood elevator, and they act by increasing the availability of monoamines in the brain. So the generation 1 drug or known as a typical antidepressant. Typical antidepressant drugs, they act by increasing the availability of monoamines, because in the depression there is a decreased monoamines in the brain. So typical antidepressant drugs or first generation antidepressant drugs, they will increase the bioavailability of monoamines either by preventing their metabolism or by decreasing their reuptake. They are their mechanism of action, right? We have already seen the symptoms of depression. Yesterday I have told you symptoms. Yesterday I have told you this classification also. So remember the classification. I would like to take once more the classification of antidepressant drugs. So first type of drugs used in the depression. देखो यहाँ पे पहले टाइप का ड्रग कौन सा होता है? माओ इनहिबिटर्स. माओ मतलब क्या? मोनो अमाइनो ऑक्सीडेज. व्हाट इज द रोल ऑफ दिस एंजाइम? दिस एंजाइम इज इन्वॉल्व इन द मेटाबॉलिज्म ऑफ biogenic amines, catecholamines. So MAO is the enzyme which inhibit the MAO or monoamine oxidase. MAO, in short form MAO. Monoamine oxidase is the enzyme that degrade, that hydrolyze, that metabolizes the biogenic amines. Amines क्या? जो आपका नॉरएड्रेनालिन है, नॉरएड्रेनालिन, डोपामाइन प्लस सेरोटोनिन, मतलब 5-HT, 5-hydroxytryptamine, noradrenaline, serotonin, they are metabolized by this enzyme, है ना? In the neurons they are synthesized locally, they are stored in the synaptic crypt. After that they are stored in the synaptic vesicles, and upon the signal they are released by the exocytosis. After release, some part of that neurotransmitter or biogenic amine will react with its receptor. Some part will be metabolized by MAO, some part will be reuptaken by reuptake mechanism, right? And there is one more receptor known as a presynaptic alpha 2 receptor or presynaptic 5-HT1A receptor. So that two receptor controls the release of catecholamines, right? So first class of drug is nothing but the MAO inhibitors. So in that there are two type, reversible and irreversible. पहला देखो irreversible inhibitor of MAO. They will bind to monoamine oxidase and irreversibly inhibit the MAO. And because of the irreversible inhibition, ये irreversibly inhibit करते हैं, उसके कारण क्या होता है कि so it will take a है ना, it will take a long duration for action, मतलब it will they are the longer acting drug. जैसे irreversible inhibitor of MAO, they will inhibit MAO irreversibly, and that's why their effect will last longly. Their effects will last long time. So irreversible inhibitor of MAO, in that you have two classes. पहला होता है hydrazine derivative. पहला है hydrazine derivative. First is a hydrazine derivative. Example is a isocarboxazide, iproniazide, and phenelzine. Isocarboxazide, iproniazide, and phenelzine. Right? All they are the non-selective MAO inhibitor. These three are the non-selective MAO inhibitor. Non-selective MAO inhibitor. ये क्या है? Non-selective. They will inhibit MAO A as well as MAO B. Non-selective MAO inhibitors. Then okay, after that non-hydrazine derivative. Non-hydrazine derivative, in that you have tranylcypromide. Tranylcypromide. Remember, irreversible MAO inhibitors, they will bind to the MAO irreversibly. There are two type of MAO. MAO के दो टाइप होता है, MAO A, MAO B. Right? So MAO A जो होता है, that is present in the GIT, that is present in the liver, that is present in the brain also. So MAO A will metabolize the noradrenaline, then 5-HT plus dopamine. So all three are metabolized by MAO A. But MAO A कहाँ पे होता है? MAO A is present in the GIT, in the liver, and in the brain. But MAO B कहाँ पे होता है? MAO B will only metabolize the dopamine. So that's why MAO A inhibitors, they are used in the depression. MAO B inhibitors, they are used in the Parkinsonism. देखो, तो MAO B is the enzyme responsible for the metabolism of dopamine, and that's why MAO B inhibitors are more useful in the Parkinsonism. They are not useful in the depression. So in the depression only MAO A inhibitors are used. So right. So this is known as a non-selective MAO inhibitors, and yeah, all these isocarboxazide, iproniazide, phenelzine, tranylcypromide, they are known as irreversible non-selective MAO inhibitors. Right? Now reversible MAO inhibitor or RIMA, reversible inhibitor of MAO A. RIMA मतलब क्या? रिवर्सिबल, देखो, रिवर्सिबल इनिबिटर ऑफ MAO A. MAO A inhibitor और सिलेक्टिव MAO A inhibitor is nothing but the मेक्लोबेमाइड. क्वेश्चन आपको आ सकता है इसके ऊपर. रिमा मतलब क्या? रिवर्सिबल इनिबिटर ऑफ MAO A. MAO A, रिवर्सिबल इनिबिटर ऑफ MAO A. मेक्लोबेमाइड क्वेश्चन आपको आ सकता है 100%. तो नॉन सिलेक्टिव MAO इनिबिटर्स आइसोकार्बोक्साइड, इप्रोनियाजाइड, फिनाल्जीन, ट्राइनिलसिप्रोमाइड. रिवर्सिबल है ना, रिवर्सिबल इनिबिटर ऑफ MAO A, रिवर्सिबल और स्पेसिफिक है ना. सो इट इज अ सिलेक्टिव MAO A inhibitor. You can say मेक्लोबेमाइड इज selective MAO A inhibitor. It does not require a strict diet instruction because it is selective in nature. They are the non-selective in nature, right? Now non-selective monoamine reuptake inhibitor, non-selective MAO reuptake inhibitor. बेसिकली क्या करना है कि डिप्रेशन में आपको यहाँ पे मोनोअमाइन, जो मोनोअमाइंस है, अमाइंस, बायोजेनिक अमाइंस, उनका लेवल बढ़ाना है. बायोजेनिक अमाइंस में कौन होता है? नॉरएड्रेनालिन, एड्रेनालिन, 5-ऑक्सीडामाइन, हिस्टामाइन, देन आपका सेरोटोनिन. ये सब क्या है कि मोनोअमाइंस है ना. तो in depression they are depleted. In depression their level is less. You have to increase the level. Now how you can increase the level? Either you can increase their production, or either you can decrease their metabolism by inhibiting the MAO, or either you can increase the level of amines in the neuron by inhibiting their reuptake, or by controlling their release, right? So how you can inhibit the reuptake? So for that, non-selective monoamine reuptake inhibitor. Now non-selective है ना, मतलब क्या? they will non-selective MAO reuptake inhibitor means they will inhibit the reuptake of noradrenaline as well as 5-HT. यहाँ पे क्या है? noradrenaline. Non-selective monoamine reuptake inhibitor, noradrenaline and 5-HT. 5-HT. They will inhibit the reuptake of both noradrenaline and 5-HT. They will inhibit the reuptake of both tricyclic and non-selective monoamine reuptake inhibitor. Both they will inhibit the reuptake of both noradrenaline plus 5-hydroxytryptamine. So in that you have tricyclic antidepressant like imipramine, risperidone, amitriptyline, nortriptyline, doxepin, nitroxapine, clomipramine. Then miscellaneous drug में आता है trazodone and venlafaxine, है ना. Now selective serotonin reuptake inhibitor, selective serotonin reuptake inhibitor, SSRI. SSRI मतलब क्या? Selective serotonin reuptake inhibitor. यहाँ पे क्या था? नॉन सिलेक्टिव माओ reuptake, मतलब they will inhibit the reuptake of noradrenaline as well as 5-hydroxytryptamine so that there will be more level of noradrenaline and serotonin at the neuron. यहाँ पे selective serotonin reuptake inhibitor, मतलब they will only inhibit the reuptake of 5-hydroxytryptamine or serotonin. So in that fluoxetine, paroxetine, fluoxamine and sertraline, citalopram, fluoxamine, sertraline, citalopram. Now selective noradrenaline reuptake inhibitor, selective noradrenaline reuptake inhibitor, इसको बोलते हैं SNRI ना, शॉर्ट फॉर्म में बोलते हैं SNRI, SNRI मतलब selective noradrenaline reuptake inhibitor ना. Example is roboxetine and meprotylene. Then mood stabilizer, in that you have lithium carbonate, miscellaneous in that you have carbamazepine, right? So you see the classification once again, as I told you. So antidepressants are also known as psychoanalytics. Antidepressants or psychoanalytics or mood elevator, they are classified into two major classes. पहला होता है आपका typical antidepressant drug. Second class is atypical antidepressant drugs. Typical antidepressant drugs, in that you have reversible MAO-A inhibitor, मतलब RIMAs, reversible inhibitor of MAO-A. Example is a meclobemide and chlorgyline. RIMA, reversible inhibitor of MAO-A, chlorgyline and meclobemide, है ना. Then next आता है आपका tricyclic antidepressant. In that you have two type. So those drug which inhibit the reuptake of both noradrenaline as well as 5-HT reuptake inhibitor. In that you have imipramine, amitriptyline, nortriptyline, imipramine, amitriptyline, then trimipramine, doxepin, dothepin and clomipramine. Okay. Now predominantly noradrenaline reuptake inhibitor, मतलब ये क्या करेंगे, ये दोनों का reuptake इनहिबिट करते हैं ना. और ये वाली जो ड्रग है वो predominantly मतलब preferentially कैसे predominantly और preferentially inhibit the noradrenaline reuptake. Example is a desipramine. Desipramine क्या है? imipramine का ही active metabolite है. Then nortriptyline क्या है? It is an active metabolite of amitriptyline. Then amoxapine is an active metabolite of doxepin. Then roboxetine. Okay, so they will inhibit the reuptake of 5-hydroxytryptamine and मतलब क्या कि पहले वाले जो ड्रग है they will inhibit the both reuptake of noradrenaline plus serotonin, and दूसरे वाले जो है they are little bit selective to the noradrenaline. Now selective serotonin reuptake inhibitor, only 5-HT reuptake inhibitor. Selective serotonin reuptake inhibitor, fluoxetine, fluoxamine, paroxetine, sertraline, citalopram, escitalopram, dopoxetine. देखो escitalopram जो है, it is a enantiomer of citalopram. Escitalopram is enantiomer of citalopram. Then fluoxetine, paroxetine, dopoxetine. Flu para flu per dopo है ना, ऐसे याद रख दो. फ्लू पर डोपो, फ्लू मतलब क्या? फ्लोक्सेटिन, फ्लोक्सामाइन, पर मतलब पेरोक्सेटिन एंड डो मतलब डोपोक्सेटिन. सिट्रालोपाम एंड इसिप्रोपाम, सर्टेनली. These are known as a selective serotonin reuptake inhibitor. तो इसके ऊपर बहुत क्वेश्चन आ चुके हैं, इसके ऊपर भी क्वेश्चन आ चुका है एक बार. नाउ थर्ड कैटेगरी इन द टिपिकल एंटीडिप्रेसेंट में आता है आपका सिलेक्टिव, है ना. फोर्थ कैटेगरी में आता है सेरोटोनिन एंड नॉर एड्रेनालिन रिएप्टेक इनहिबिटर, इसको बोलते हैं अपन, है ना, SNRIs, ना, serotonin noradrenaline reuptake inhibitor, SNRIs. So they are not a tricyclic, that's why. So venlafaxine and duloxetine. Now atypical antidepressants. Now typical वाले क्या करते हैं? Typical antidepressant drugs, they somehow increases the level of monoamines. ये जो ड्रग्स है अपने कौन से टिपिकल, है ना, टिपिकल एंटीडिप्रेसेंट्स, दे इंक्रीजेस द लेवल ऑफ मोनोअमाइन्स, बिकॉज डिप्रेशन में क्या है कि मोनोअमाइन्स का लेवल कम हुआ है, दैट्स व्हाई दे समहाउ विल इंक्रीज द लेवल ऑफ, है ना, पायोजेनिक अमाइन्स. सो आइदर बाय प्रिवेंटिंग द मेटाबॉलिज्म लाइक माओ इनहिबिटर, और आइदर बाय प्रिवेंटिंग द रीअपटेक, है ना, लाइक अदर. दैट्स व्हाई दे आर नथिंग बट द typical antidepressant drugs which increases the level of biogenic amines somehow. Now atypical antidepressants, they act by different mechanism. इनका mechanism अलग होता है ना, इनका mechanism अलग होता है. So they act by different mechanism, like some of them are alpha agonist, some of them are 5-HT1A blocker, some of them are dopamine blocker, like that. So trazodone, then mianserin, mitrazepine, then bupropion, then tinaptine, amineptine, and atomoxetine, amineptine, tinaptine, bupropion, mitrazepine, mianserin, trazodone. आपको ये क्लासिफिकेशन आपको याद रखना है ना. यू कैन अप्लाई योर ओन ट्रिक्स ऑल्सो, है ना. जो मेरे ट्रिक्स है वो सब आपके काम आएंगे. ये इसका कोई, है ना, इसका कोई लॉजिक होता नहीं. तो लॉट ऑफ पीपल दे यूज्ड टू एक्सप्लेन यू ट्रिक्स, बट मेरे पास ट्रिक्स थोड़े से कम होते हैं, लेकिन मेरे पास बेसिक से जाता हूँ मैं, है ना. मैं ज़्यादा बेसिक के ऊपर भरोसा करता हूँ. ट्रिक्स लगा के आप यहाँ पे कोई नाम ढूंढ सकते हो, या फिर लास्ट टाइम भी मैंने बोला दो. देखो, माओ इनहिबिटर्स, मोनो अमीनो ऑक्सीडेज इनहिबिटर, पहला क्लास है एंटीडिप्रेसेंट का माओ इनहिबिटर्स. तो मैकेनिज्म ऑफ एक्शन क्या है? तो दे इनहिबिट द मोनो अमीनो ऑक्सीडेज, है ना. दे ब्लॉक द ऑक्सीडेटिव डीएमाइनेशन ऑफ नेचुरली ऑकरिंग अमाइन सच एज noradrenaline, 5-HT, and dopamine present in the brain. And there are two types of MAO A and MAO B. So inhibition of MAO result in the prevention or decrease in the deamination of noradrenaline and 5-HT. MAO A जो होता है that will inhibit the MAO A will metabolize the 5-HT and noradrenaline. तो MAO A का काम है कि noradrenaline 5-HT को metabolize करना. तो inhibition of MAO A increased in the increased level of noradrenaline and serotonin, and that's why, you know, they will decrease the symptoms of depression. So this MAO A is present in the GIT, liver and brain. GIT, liver and brain. Second होता है आपका MAO B. Second one is the MAO B. And the second one is the MAO B. So MAO B means what? So it is the enzyme again metabolizes the selectively dopamine. तो ये क्या करता है? Deamination of dopamine. So basically dopamine is metabolized by this enzyme, right? So that's why. But depression is because of the mostly because of the depletion of serotonin and noradrenaline. So that's why MAO A inhibitors are more useful in the depression. But MAO B inhibitor, they will increase the level of dopamine in the brain. They are useful as anti-Parkinson drugs. MAO B is present in the brain, liver, and RBCs, right? So they are not having any antidepressant effect. MAO B inhibitor जो होते हैं उनको antidepressant effect होता ही नहीं. Only MAO A inhibitors are having antidepressant effect. When we'll see the drug used in the Parkinsonism, at that time I will explain you कि बाबा MAO B का रोल क्या है again. Okay? So you can see over here जो serotonin है, जो आपका 5-hydroxytryptamine है, that is synthesized from tryptophan amino acids. So tryptophan is transported across the neuronal membrane. The neuron tryptophan is converted into 5-hydroxy-tryptophan. There is a hydroxylation. 5-hydroxy-tryptophan. Then 5-hydroxy-tryptophan is converted into tryptamine. 5-hydroxy-tryptophan is converted into tryptamine. 5-hydroxy-tryptamine by the decarboxylation. 5-HT decarboxylase. Right? Now this 5-hydroxy-tryptamine or serotonin is stored in the vesicles. Upon signal they are released. Some of them are rare. They will interact with the 5-HT2 receptor. 5-HT2 receptor in the brain. On the है ना, यहाँ पे जो बनता है 5-hydroxytryptamine वो रिलीज होगा अपॉन सिग्नल. कुछ पार्ट जो है वो 5-HT2R तो पोस्ट सिनेप्टिक रिसेप्टर है उसके ऊपर एक्ट होगा. सम पार्ट ऑफ 5-HT will be reuptaken. Some part of 5-HT will be reuptaken into synaptic vesicle. Some part of serotonin will be metabolized by enzyme known as a MAO. जो released neurotransmitter है उसका metabolism होता है MAO में. And the release is controlled by this mechanism known as 5-HT1R. There is a presynaptic receptor, 5-HT1R, which control the release of serotonin. So likewise in the आपके जो noradrenaline that is synthesized from phenylalanine, so we'll see that upcoming sympathomimetic drug noradrenaline का synthesis होता है, and noradrenaline is biosynthesized from phenylalanine amino acids. Phenylalanine is converted to tyrosine. Tyrosine is converted to dopa. Dopa is converted to dopamine to noradrenaline, and then adrenaline. Noradrenaline is converted to released, and it is acting on alpha receptor, beta receptor. Some part will be reuptaken, some part will be metabolized by again MAO, right? So that's why, right? So what are the targets? So you can increase the level of this serotonin by, है ना, यहाँ पे आपका एम क्या है कि सेरोटोनिन का लेवल यहाँ पे ज़्यादा होना चाहिए ताकि डिप्रेशन का सिम्टम्स कम हो जाए. तो व्हाट इज योर एम? टू इंक्रीज द सेरोटोनिन लेवल एट अ साइनेप्स. हाउ यू कैन इंक्रीज द सेरोटोनिन लेवल? ना, either you can decrease the reuptake, or you can decrease the metabolism, or you can inhibit the metabolism, or you can control the release, or you can control the more release, right? So that's why MAO inhibitors are used. Then selective serotonin reuptake inhibitors are used. Then serotonin and noradrenaline reuptake inhibitors are used. We'll see. तो पहला है MAO inhibitors and mechanism of action we have seen. Then potentiation of action of MAO inhibitors. MAO inhibitors actions are increased by, तो MAO inhibitor है उनके actions कौन बढ़ाता है? अल्कोहल. MAO inhibitors will increase the actions of alcohol, sympathomimetics, anesthetic, anticholinergic drugs, then antihistaminic drug, narcotic and antidepressant drugs. जो भी MAO inhibitors यूज कर रहा है तो उसमें अल्कोहल का ज़्यादा एक्शन होगा, सिंपैथोमाइमेटिक का ज़्यादा एक्शन मिलेगा, सो एनेस्थेटिक का पोटेंशिएशन होगा, एंटीकोलिनर्जिक ड्रग का पोटेंशिएशन, एंटीहिस्टामिनिक का पोटेंशिएशन होगा, नार्कोटिक एनाल्जेसिक का पोटेंशिएशन होगा, एंटी डिप्रेसेंट का पोटेंशिएशन, राइट? नाउ फार्माकोलॉजिकल एक्शंस ऑफ MAO inhibitor, वेरी इंपॉर्टेंट क्वेश्चन आता है इसके ऊपर. Now what is the effect of MAO inhibitors on behavior? मतलब जो जितने भी MAO inhibitor है ना, बाद में अपन इंडिविजुअल एडवर्स इफेक्ट वो वगैरह देखेंगे. इन जनरल और इवन से इन प्रोटोटाइप फार्माकोलॉजिकल एक्शंस ऑफ योर MAO inhibitors. पहला है आपका बिहेवियरल इफेक्ट. व्हाट इज द इफेक्ट ऑन बिहेवियर? So they will increase the mood, they will elevate the mood. They are known as a mood elevator. So they will increase the mood, decrease the suicidal tendency. So depression, जो भी डिप्रेशन का पेशेंट है, डिप्रेस्ड पेशेंट will always have suicidal thoughts. डिप्रेस्ड पेशेंट विल हैव ऑलवेज सुसाइडल थॉट्स। इससे आपने एक्टर का एग्जांपल ले लो, कौन है अभी अपने एक्टर जे सुशांत है ना, सुशांत सिंह राजपूत ना, सगळं काही होतं ना, सब कुछ था उनके पास, फेम था ना, पैसा था, सब कुछ लव था, लग्जरी थी, then why there is no need to do suicide, but why? Because he was suffering from depression ना। सुशांत सिंह राजपूत जो थे उनको डिप्रेशन था, एंड बिकॉज ऑफ दैट उनको उनको डिप्रेशन था, उनमें सब था उनके लाइफ में है ना, पैसा था, फेम था, लव था, लग्जरी थी, सब कुछ था, फिर भी सुसाइड किया। क्यों? डिप्रेशन है ना, डिप्रेशन है ना। डिप्रेशन अगर हो गया तो पेशेंट विल हैव सुसाइडल टेंडेंसीज, सुसाइड करने का ट्राई करेगा। तो एंटी डिप्रेसेंट विल एलिवेट द मूड है ना, द पेशेंट विल टेक इंटरेस्ट इन द सराउंडिंग, एंड एंटी डिप्रेसेंट विल डिक्रीज द सुसाइडल टेंडेंसी, सुसाइड टेंडेंसी कम करेगा। सब्जेक्ट विल फील एनर्जेटिक्स एंड फ्रेश, subject will feel energetic and fresh. Then what is the action on a cardiovascular system? Some of these MAO inhibitors, they have hypotensive effect, मतलब क्या, blood pressure कम कर सकते हैं। Some of them have hypotensive effect. Then third one is the reserpine reversal, very important. Reserpine reversal, very important. Reserpine reversal, reserpine reversal. तो reserpine क्या है? इट इज अल्कोलाइड ऑप्टेन फ्रॉम राउल्फिया सर्पेंटिना, राउल्फिया सर्पेंटिना से ये अल्कोलाइड आता है। एंड अल्कोलाइड क्या है? इट इज नोन एज कैटेकोलामाइन डिप्लीटर, इट इज वन ऑफ द एंटी हाइपरटेंसिव ड्रग आल्सो, एंटी साइकोटिक ड्रग आल्सो। रेजरपिन एंटी साइकोटिक भी है, एंटी हाइपरटेंसिव भी है। इट इज अ कैटेकोलामाइन डिप्लीटर, मतलब क्या, सेंट्रल नर्वस सिस्टम में जो मोनोमाइन से उसको डिप्लीट कर देगा, उसको हकार लेगा। एंड डिप्रेशन में वही होता ना। तो so MAO inhibitors, they causes the reserpine reversal, मतलब क्या, normally when animal is treated with the reserpine, normally when mice are treated with the reserpine, को माइस लेना है, माइस को पहले reserpine देना है, reserpine है ना, reserpine। now they are inert and apathic, मतलब they will not take interest in the surrounding and do not take interest in the surrounding, तो वो एपैथिक है। बट है ना, मतलब रेजरपिन क्या करता है कि डिप्रेशन करता है। इन शॉर्ट रेजरपिन विल कॉज डिप्रेशन, राइट। So when animals are treated with the reserpine, so animal will not take part in the surrounding, he will be inert, he will be apathic, do not show interest in the surrounding. But if the same animal is already treated with the MAO inhibitors, okay, if animal is pre-treated with the MAO inhibitors दे देंगे आप उनको, तो बाद में रेजरपिन देंगे, बिकॉज ऑफ द MAO इनहिबिशन ना। MAO इनहिबिशन मेटाबॉलिज्म होगा ना कैटेकोलामाइन का, ज्यादा कैटेकोलामाइन वहां पे अवेलेबल रहेगा, ज्यादा बायोजेनिक अमाइंस वहां पे आएगा। दैट्स व्हाई नॉर्मली रेजरपिन कॉजेज द एपैथिक, इनर्ट और डिक्रीज इन द इंटरेस्ट, बट प्री ट्रीटमेंट ऑफ MAO inhibitor and then reserpine produces the opposite effect, known as produces the agitation, मतलब कि aggressiveness and excitement. This is known as the reserpine reversal. तो अपन क्या बोलते हैं, reserpine reversal। क्वेश्चन आता है, ऑलरेडी आ चुका है, reserpine reversal और reserpine reversal is related with the use of, it is a MAO inhibitor। ये होता क्या है कि reserpine और राउल्फिया अल्कोलाइड्स, they are depressant drugs, मतलब that's why राउल्फिया is also known as a पगले की दवा, राउल्फिया। तो रेजरपिन इज एंटी साइकोटिक एज वेल एज एंटी हाइपरटेंसिव, ठीक है। तो माओ है ना, रेजरपिन अगर देंगे एनिमल को, एनिमल विल नॉट टेक पार्ट इन द सराउंडिंग, ही विल बी इनर्ट, ही विल बी अपैथिक। बट व्हेन एनिमल इज प्री ट्रीटेड, पहले ही उसको MAO इनहिबिटर्स देना है और उसके बाद में रेजरपिन देना है, तो क्या होगा, नॉर्मली रेजरपिन ने तो डिप्रेशन करना चाहिए, बट ड्यू टू प्रायर एडमिनिस्ट्रेशन ऑफ योर MAO inhibitors, Now the animal behaves aggressive, agitation, excitement. So that phenomenon is nothing but the reserpine reversal. Okay, I hope you are getting my points. If I am audible to you, please write yes in the comment box. Next is nothing but the potentiation of sympathomimetics. जो सिंपैथोमाइमेटिक ड्रग्स है या फिर एड्रेनर्जिक ड्रग्स है, उनका एक्शन क्या करता है? पोटेंशिएट करता है. पोटेंशिएशन ऑफ sympathomimetic, they will potentiate the action of amphetamine and heparin. So MAO inhibitors are avoided in case of these drugs. Miscellaneous action देखो, these drugs also inhibit the MAO and other enzymes of the liver, and that's why they can prolong the metabolism of other drugs. MAO inhibitors are the potent REM sleep inhibitor. REM मतलब क्या? Rapid eye movement, है ना? If you already listen or if you already attended the lecture known as the sedative hypnotics, in that I have told you REM sleep and NREM sleep. ADME, absorption, distribution, metabolism, elimination of these MAO inhibitors. They are well absorbed orally. They will produce the long lasting effect. क्यों? They will produce the long lasting effect. क्यों लेकिन? Because MAO inhibitor, they irreversibly bind with the MAO and inhibit the MAO. Or because of that, but repeated use of MAO inhibitor will also desensitize the receptor, presynaptic receptor, responsible for the control of release of noradrenaline and 5-HT. Because of that desensitization, the effect of MAO inhibitor will last for long. That's why long lasting effect is there. ठीक है, ये क्लियर होना चाहिए आपको. So the effect will last for at least 10 to 12 days, 10 to 14 days. So MAO inhibitors, right? Now adverse reactions of MAO inhibitors. Adverse reactions of MAO inhibitors. मतलब सब आइसोकार्बोक्साइड, मेक्लोबिमाइड सगळे. So MAO inhibitors adverse effect on the behavior क्या adverse effect? They will cause headache. Excitement, agitation मतलब aggressiveness. They can produce hallucination. Then hyperplexia. They can cause hyperplexia and disturbance in the sleep. All these drugs are contraindicated in case of schizophrenia and psychosis. Because क्या है कि one antidepressant drugs, they are exactly acting opposite to the antipsychotic drugs. एंटीसाइकोटिक ड्रग क्या करते हैं कि वो डोपामाइन को ब्लॉक करते हैं. यहाँ पे ये क्या कर रहा है? ये नॉरएड्रेनालिन, डोपामाइन, 5-HT इनका लेवल बढ़ रहा है MAO इनहिबिटर. तो एंटीडिप्रेसेंट्स दे आर नॉट कंपेटेबल विद द एंटीसाइकोटिक ड्रग्स. ठीक है, दे आर कॉन्ट्राइंडिकेटेड इन केस ऑफ स्किज़ोफ्रेनिया एंड साइकोसिस. नाउ ऑन द CNS, सेंट्रल नर्वस सिस्टम के ऊपर क्या इफेक्ट है देखो. So on a CNS, MAO inhibitors, they will produce insomnia, lack of sleep, tremors, involuntary contraction of muscle, twitching, ज़्यादा contraction. They can cause ataxia, hyperplexia, and convulsions. मतलब MAO inhibitor can produce epilepsy. Iproniazide, isocarboxide can induce peripheral nephropathy, peripheral neuropathy, known as peripheral neuritis, and they can be treated with the pyridoxine. अभी ये जो लाइन है इंपॉर्टेंट है. इप्रोनियाजाइड, isocarboxide, they can cause peripheral neuritis मतलब peripheral neuropathy, that can be treated with the pyridoxine मतलब क्या? vitamin B6. There is one more drug known as a isoniazide. It is actually drug used in the tuberculosis, but isoniazide, iproniazide, isocarboxide, they will have a similar structure, and that's why all they will cause peripheral neuropathy मतलब peripheral nerves का inflammation करेंगे. And to treat that, pyridoxine is a drug. इसके ऊपर अभी तक 4 बार क्वेश्चन आए. ठीक है, एंड नेक्स्ट देखो आप. नेक्स्ट hypertensive crisis. So MAO inhibitors can cause hypertensive crisis, but when when MAO inhibitors are given together with the sympathomimetic drugs. MAO inhibitors when given together with the amphetamine, it is a sympathomimetic drug, amphetamine, ephedrine. So there is increase in the hypertension because क्या है ये amphetamine ephedrine क्या करता है ऑलरेडी sympathomimetic है मतलब क्या they will act as agonist to the noradrenaline receptor. MAO inhibitors also doing, they are increasing the noradrenaline, so that's why there is a hypertensive crisis. Again very important reaction is there known as cheese reaction. इसके ऊपर क्वेश्चन आता है cheese reaction. अब ये चीज रिएक्शन क्या होता है मैं आपको इसमें करता हूं. चीज रिएक्शन क्या होता है चीज रिएक्शन क्या है when MAO inhibitors are given along with the if MAO inhibitors are taken with the food containing tyramine, जो फूड होता है आपका, so food like cheese, red wine, then yogurt, chocolate, buttermilk, coconut extract, soyabeans, figs and ripe bananas. पका हुआ केला, figs मतलब अंजीर, soyabeans, coconut, buttermilk, chocolate, yogurt, wine, red cheese. Now all these food items, cheese हो गया, red wine हो गया, yogurt हो गया, coconut हो गया, buttermilk हो गया, chocolate हो गया, soybean extract हो गया, figs हो गए, अंजीर हो गए, फिर आपके पके हुए केले हो गए. तो all these food stuff will have one chemical known as tyramine. इनमें सब में क्या होता है tyramine होता है. कौन सा माइन? Tyramine है ना. Tyramine. This tyramine is a precursor for the synthesis of serotonin. Tyramine क्या है? It is a non, it is a क्या बोलते हैं इसको? It is an indirect acting sympathomimetic. Tyramine is an indirect acting sympathomimetic, and it is also precursor for dopamine and 5-HT. ये indirectly acting sympathomimetic होता है, precursor होता है इसके लिए dopamine 5-HT के लिए. So tyramine containing food like milk product, butter, chocolates, coconut, soybean, figs and ripe banana, they will have tyramine, and it is a precursor for dopamine and 5-HT. So if you take MAO inhibitors and tyramine together, क्या होगा? You are inhibiting the MAO, so you are increasing the level of dopamine 5-HT, and again you are giving along with that this tyramine, which is also precursor for 5-HT and all that. There is a higher level of this neurotransmitter, and hypertension is there. A lot of other complications are also there. So known as a cheese reaction. And remember, in the cheese reaction, drug of choice is nothing but the pentolamine. In the cheese reaction, drug of choice is a pentolamine. P इसलिए लिखा है मैंने. It is a drug of choice in the cheese reaction, pentolamine. Now autonomic effect देखो, autonomic effect. तो autonomic nervous system के ऊपर क्या करता है? Hydrazine compound can cause constipation, then dryness of mouth, blurring of vision, impotence, difficulty in the micturition, मतलब पेशाब करने में दिक्कत आएगी, difficulty in the micturition, impotence करेंगे, blurring, मतलब most of them are showing cholinergic symptoms. In the liver, iproniazide can cause hepatocellular jaundice. Iproniazide on liver can cause jaundice. ये सब एडवर्स इफेक्ट है MAO इनहिबिटर्स के, याद रखना है आपको. It can cause all these adverse effects. Now see the next part. Now typical antidepressant. देखो यहाँ पे typical antidepressants, they act by inhibiting the reuptake of both noradrenaline plus 5-HT. Typical antidepressants, they inhibit the metabolism of both 5-HT as well as noradrenaline. The drug like clomipramine, meprotylene, and then bupropion. The drug like clomipramine, मिप्रोटिलीन एंड बिप्रोपायोन, they can also decrease the सीजर थ्रेशोल्ड. मतलब क्या कि जो सीजर आने के लिए जो फायरिंग लगता है न्यूरॉन में, इसको डिक्रीज करेंगे, सो दैट सीजर विल बी immediate. So they can produce seizures, they can cause weight gain, is another issue. Weight gain is a problem. Then again, use of tricyclic antidepressant. If you use typical antidepressant, there is a tricyclic antidepressant, so they can cause decrease the seizure threshold, they can cause weight gain, they can cause weight gain with the mostly with the TCS. The tricyclic antidepressant के साथ में ये एडवर्स इफेक्ट ज़्यादा होता है. Most of the TCA मतलब tricyclic antidepressants, they are powerful anticholinergic, and that's why they can cause delirium, urine retention, blurring of vision, constipation, and also most of the typical antidepressant मतलब tricyclic वाले, so they also has a weak alpha receptor blocking activity, and that's why they can cause postural hypotension and cardiac arrhythmia. Also they cause delay in the ejaculation because alpha receptor is also present in the penis, and that's why they will decrease the ejaculation come करेंगे, and that's why sometimes they are used to treat the erectile dysfunction. Tricyclic antidepressants, they are having low safety of margin. अपन देखेंगे डिटेल में. ये एक ड्रग होता है एमोक्सेपिन. एमोक्सेपिन इज एडिशनली D2 receptor blocking. Amoxapine along with the inhibition of 5-HT noradrenaline reuptake also block the D2 receptor, which is it is also having antipsychotic action. The antidepressant भी है, antipsychotic भी है. It is actually a metabolite of loxapine. Loxapine क्या है? Antipsychotic है, तो ये metabolite है. And also inhibit the reuptake of noradrenaline. Tricyclic antidepressants are useful in the nocturnal analysis. मतलब बेड वेटिंग फिनोमेना है ना, रात में सो गए, बेड के ऊपर कार्यक्रम कर दिया. बच्चों में होता है बेड वेटिंग, नॉक्टर्नल एनेवरेसिस. सो पर्टिकुलरली इमिप्रामाइन जो होता है, इट इज अ ड्रग यूज्ड इन द नॉक्टर्नल एनेवरेसिस, बट ड्रग ऑफ चॉइस इज अ डेस्मोप्रेसिन. ड्रग ऑफ चॉइस इज अ डेस्मोप्रेसिन. नाउ उसके बाद में आता है सिलेक्टिव सेरोटोनिन रीअपटेक इनहिबिटर. So selective serotonin reuptake inhibitor, they only block the reuptake of 5-HT and they are not having anticholinergic alpha. So as compared to tricyclic antidepressants, selective serotonin reuptake inhibitor, they will not have anticholinergic effect, they will not have alpha blocking activity, and that's why remember selective serotonin reuptake inhibitors, they are the first choice of drug used in the depression, phobia, obsessive compulsive disorder, post-traumatic stress disorder, bulimia nervosa. Bulimia nervosa मतलब भूख ज़्यादा लगती है पेशेंट को. Pre-menstrual tension syndrome, panic attack of psychosis, and no adverse effect of tricyclic antidepressant. मतलब जो यहाँ पे पोस्चरल हाइपोटेंशन, कार्डियक अरिथमिया, ब्लरिंग ऑफ विजन, जो एंटी कोलिनर्जिक इफेक्ट थे ड्यू टू अल्फा ब्लॉकिंग एडवर्स इफेक्ट थे, वो अभी इसमें नहीं है. बट इन केस ऑफ सेरोटोनिन रिअप्टेक, मोस्ट कॉमन एडवर्स इफेक्ट, मोस्ट फ्रीक्वेंट इज नथिंग बट द nausea is there. Then inhibition of ejaculation, so that's why they can prolong your ejaculation time. Serotonin syndrome मतलब क्या? Serotonin syndrome, they can cause serotonin syndrome along with the other drugs, akathisia and bleeding. These are the adverse effects of selective serotonin reuptake inhibitor. Now fluoxetine, इसमें जो fluoxetine होता है वो longest acting drug है. It is a prototype for selective serotonin reuptake inhibitor. Fluoxetine is longer acting, longest acting, and it is a prototype of your SSRI. Then fluoxamine is the shortest acting. Fluoxamine क्या होता है? Shortest acting. Fluoxamine is a shortest acting. Then escitalopram is the most specific selective serotonin reuptake inhibitor. paroxetine is the most teratogenic in nature. तो यहाँ पे एक शॉर्ट में दिया है इन्फॉर्मेशन मैंने, but in detail we'll see up now. In detail we'll see. You can see here tricyclic antidepressants. क्या है भाई? Tricyclic antidepressants. Imipramine is most commonly used drug. It is a prototype for tricyclic antidepressant. Doxepine, amitriptyline, nortriptyline, there are other drugs, right? So mechanism of action क्या है tricyclic antidepressant का? So they will increase the release of noradrenaline, pyridostigmine, and dopamine. How? Because of the prevention of reuptake. They are the again potent microenzyme inhibitor of neuronal pyrosity and noradrenaline reuptake in the brain. So they inhibit the reuptake of noradrenaline, pyridostigmine in the brain. That's why they increase the release of this. They increase the level of these monoamines in the synapse. Now they can cause variable blockage at alpha 1 receptor and also to some extent alpha 2 adrenoreceptor. They can cause they are also central anticholinergic properties. मतलब क्या? ये anticholinergic होते हैं, alpha blocker होते हैं, and because of that they are having adverse effect. Now what are the pharmacological actions of this tricyclic antidepressant on the behavior of the depressed patient? डिप्रेशन का शिकार है, डिप्रेशन को जो है इसमें क्या होगा? They exerts antidepressant effect like MAO inhibitor. मतलब they elevate the mood, patient will take interest in the surrounding, decrease in the suicidal tendency, and they are also anti-anxiety. They are also anxiolytic in nature. Again, on a CNS, they can produce a drowsiness. Feeling of light head. Sedation is the most common adverse effect. They can produce reduce the threshold of seizure. They can produce epilepsy. They will suppress the REM sleep. Physical dependency is rare to this. Autonomic nervous system के ऊपर क्या है? Pharmacological actions. They are anti-muscarinic removal. They are anti-muscarinic, and that's why they can cause adverse effect like dryness of mouth, constipation, blurring of vision, and palpitation. आपको ये इफेक्ट कब समझ में आएंगे? When we'll take drug acting on ANS. तो CNS में ये चल रहा है, अभी ANS बाकी है. ड्रग एक्टिंग ऑन ANS में आता है आपका सिम्पैथोमाइमेटिक ड्रग, सिम्पैथोलाइटिक ड्रग्स, देन पैरासिम्पैथोमाइमेटिक ड्रग, पैरासिम्पैथोलाइटिक ड्रग्स. देखो ADME absorption distribution metabolism elimination. Absorption distribution metabolism elimination. All these tricyclic antidepressants, they are good absorbed from oral. They are highly lipid soluble molecule. Imipramine is converted into active metabolite known as a imipramine is converted into imipramine जो है उसको convert करते हैं. Imipramine after metabolism in the body is converted into desmethyl imipramine. Desmethyl imipramine is a metabolite of imipramine which is known as a desipramine. Desmethyl imipramine is a metabolite, and now it is a separate drug, desipramine. They are metabolized in the liver and removed through kidney. Adverse reaction देखो इनकी क्या है? Adverse reaction due to dopamine receptor blockage. Due to D2 blockage, we can produce galacturia. That is adverse effect. Galacturia. They will increase the prolactin level. Due to blockage of dopamine receptor. Right. Now, the clomipramine has a clomipramine जो है that is having galacturia as a adverse effect. Amoxapine is also having galacturia as an adverse effect. Pharmacopramine is also having. Amitriptyline both कम है, nortriptyline both कम है. They can produce allergic reactions like a urticaria, skin rashes, pruritus, and photosensitivity. Anti-muscarinic effect क्या है? Dryness of mouth, constipation, bradycardia, difficulty in the maturation, impotence, and delayed ejaculation. CNS में feeling of tiredness, lethargy, headache, sedation, ये adverse effect. Cardiovascular के ऊपर because of the alpha blocking activity, they can produce a postural hypotension, cardiomyopathy and liver and cardiomyopathy and heart failure. Miscellaneous में आता है कोलेस्टेटिक जॉन्डिस, कोलेस्टेटिक जॉन्डिस. नाउ इनकी यूजेस क्या है, इसके ऊपर क्वेश्चन आता है. थेरापेटिक यूजेस ऑफ ट्राइसाइक्लिक एंटीडिप्रेसेंट. They can cause, they are used in the mental depression, they are used in the mental depression, acute panic attack of depression. They are also used in the OBS, obsessive compulsive neurosis, obsessive compulsive disorder. Obsessive compulsive disorder जो है, obsessive compulsive neurosis, they are also used in the nocturnal neurosis. Nocturnal neurosis मतलब क्या, bed waiting. Imipramine is a drug used in the nocturnal neurosis, but drug of choice is a desmopressin is a drug of choice. Desmopressin is a drug of choice in a nocturnal neurosis. They are also used in the bulimia nervosa, भूख बहुत ज़्यादा लगता है तो. Also used in the migraine, differentiation pain. They are also used in the ADH, attention deficit hyperactivity disorder, ADHD. Then also used in the chronic fatigue syndrome. These are the uses of your tricyclic antidepressant. ये ट्राइसाइक्लिक एंटीडिप्रेसेंट के यूजेस है. डिप्रेशन में आता है ना बहुत सारा, न्यूरोसिस में ज़्यादा यूज करते हैं. यस, नेक्स्ट सिलेक्टिव सेरोटोनिन रीअपटेक इनहिबिटर. सिलेक्टिव सेरोटोनिन रीअपटेक इनहिबिटर मतलब दे विल इनहिबिट ओनली 5-HT. देखो इसमें एग्जांपल क्या है, फ्लोक्सेटिन, फ्लोक्सामाइन, पैरोक्सेटिन, सर्टालिन, citalopram. These are the selective serotonin reuptake inhibitor. So they are also effective in the moderate depression. They are not effective in the much. They are not effective in the severe depression. They are used in the moderate depression. Less effective in the severe depression. Less effective in the severe depression. ज़्यादा डिप्रेशन है तो उसमें ये ज़्यादा यूजफुल नहीं है. मीडियम डिप्रेशन, मॉडरेट डिप्रेशन है तो यूजफुल है. They have advantages over the tricyclic antidepressant. They are having some advantages over the tricyclic antidepressant. क्यों? Because they will not block the muscarinic system. They are not anti-muscarinic. They will not block the alpha receptor. So they are having less anti-muscarinic effect, less sedative, and less cardiovascular effect. They are safer drug than the tricyclic antidepressant. तो इनका ADME देखो, absorption, distribution, metabolism. They are well absorbed orally, metabolized and eliminated slowly. Interfere with the CYP450 enzyme system. Fluoxetine is metabolized to active metabolite known as norfluoxetine. Fluoxetine जो है वो metabolize होके fluoxetine का metabolite होता है norfluoxetine, which is also having antidepressant activity. Trazodone, venlafaxine and nepazidone, they are having short half-life. देखो mechanism of adverse effect of tricyclic antidepressant. तो tricyclic antidepressant वो adverse effect क्यों दिखाते हैं, उसका reason है. तो जैसे for example tricyclic antidepressant inhibit the presynaptic noradrenaline reuptake, and that's why they can induce a tremors and insomnia. ज़्यादा noradrenaline रहेगा so that's why they can cause tremors and insomnia. Also on a cardiac, they will inhibit the they will act cardiac fast sodium channels, so they can produce, because of the inhibition of this cardiac fast sodium channels जो हार्ट में जो cardiac fast sodium channel है उसको इनहिबिट करते हैं. because of that they can produce a conduction defect मतलब क्या, arrhythmia and hypotension. Due to their muscarinic blocking activity or inhibition of muscarinic receptor, hyperthermia, flushing, mydriasis, paralytic illness, urine retention and sinus tachycardia. Due to alpha blockage, they can produce a postural hypotension. है ना, मतलब अभी मैं बैठा हूँ तो मेरा ब्लड प्रेशर नॉर्मल है, अगर मैं लेट जाऊँगा तो मेरा ब्लड प्रेशर डिक्रीज होता है. पोस्चर चेंज हुआ है, ब्लड प्रेशर डिक्रीज होता है, पोस्चरल हाइपोटेंशन. Due to histamine blockage, they can produce sedation. So these are the adverse effects of tricyclic antidepressant. क्यों है adverse effect, उसका रीजन. Now, adverse reactions of your selective serotonin reuptake inhibitor. Adverse reactions of ASSRI, जो selective serotonin reuptake inhibitor है उसका adverse effect. They can cause nausea, anxiety, jitterness, insomnia, headache, erectile dysfunction. They can cause same degree of sexual thoughts of orgasm in the both male and female. They can cause mania when they are used in the patient in a bipolar disorder, underdiagnosed bipolar disorder. अगर selective serotonin reuptake inhibitor यूज किया अंडर डायग्नोज्ड बाइपोलर डिप्रेशन, मतलब कोई पेशेंट है जो बाइपोलर डिप्रेशन से सफर हुआ है बट डॉक्टर को मालूम ही नहीं, लेकिन उन्होंने क्या किया कि उसको सिलेक्टिव सेरोटोनिन रीअपटेक इनहिबिटर दे दिए. तो इन दैट पेशेंट द एसएसआरआई कैन कॉज मैनिया. नेक्स्ट, कंकरेंट यूज ऑफ सिलेक्टिव सेरोटोनिन रीअपटेक इनहिबिटर एंड माओ इनहिबिटर. साथ में अगर माओ इनहिबिटर एंड सिलेक्टिव सेरोटोनिन रीअपटेक इनहिबिटर देंगे तो क्या होगा सेरोटोनिन सिंड्रोम, सेरोटोनर्जिक रिएक्शन और सेरोटोनिन सिंड्रोम. कंकरेंट यूज ऑफ सिलेक्टिव सेरोटोनिन रीअपटेक इनहिबिटर एंड माओ इनहिबिटर. देखो माओ इनहिबिटर क्या करते हैं, दे इनहिबिट द मेटाबॉलिज्म ऑफ नॉरएड्रेनालिन, OST एंड डोपा. Selective serotonin reuptake inhibitor क्या कर रहे हैं, they will inhibit the reuptake of OST. So because of the combined use of both these, there is a huge increased level of OST in the neuron, and that's why it is known as a serotonin syndrome or serotonergic reaction, which comprises cognitive behavioral disorder. मतलब ज़्यादा लोग सेरोटोनिन हो जाएगा, क्या होगा, ज़्यादा OST हो जाएगा तो क्या होगा, कॉग्निटिव बिहेवियरल सिम्टम्स लाइक इंसोम्निया, इंसोम्निया हो जाएगा, एंजाइटी हो जाएगा, हाइपोमेनिया, एजिटेशन, एटोनॉमिक सिम्टम्स लाइक नॉसिया, सलाइवेशन, डायरिया, एब्डोमिनल पेन. So it is known as serotonin syndrome. It is known as a serotonin syndrome. Neuromuscular symptoms like shivering of your muscle, rigidity, twitching, and rhabdomyolysis. So that's why it is known as serotonin syndrome. तो देखो यहाँ पे एक इंपॉर्टेंट चीज है, व्हेन माओ इनहिबिटर्स एंड सेरोटोनिन सेलेक्टिव सेरोटोनिन रीअपटेक इनहिबिटर्स, when they are combined together they can produce a serotonin syndrome, fetal serotonin syndrome or serotonergic reaction. इनकी यूजेस क्या है, थेरेप्यूटिक यूजेस ऑफ selective serotonin reuptake inhibitor. Selective serotonin reuptake inhibitor are used in, they are alternative for tricyclic antidepressant. Patient having high risk of suicide, in that they are used. Patient who is accident prone, patient having obsessive compulsive disorder in a manic phase of bipolar disorder. मतलब ये OCD में यूज करते हैं, बाइपोलर डिसऑर्डर में यूज करते हैं, मैनिक फेज जिसमें मैनिया होता है उसमें यूज. न्यू एंटीडिप्रेसेंट्स, न्यू ड्रग जो है उसमें वेनलाफेक्सिन, विच इज वेनलाफेक्सिन इज अ बाइसाइक्लिक फिनाइल इथालामाइन डेरिवेटिव. उसका मैकेनिज्म क्या है, इट इज अ पोटेंट OST एंड नॉरएड्रेनालिन रीअपटेक इनहिबिटर. इट कैन कॉज एडवर्स इफेक्ट लाइक दिस nausea, dizziness, dryness of mouth and sexual dysfunction. मोस्ट ऑफ द एंटीडिप्रेसेंट ड्रग जो है ना वो सेक्सुअल डिस्फंक्शन करते ही करते, उनको पोस्चरल हाइपोटेंशन एज है ना, उनको पोस्चरल हाइपोटेंशन एज एडवर्स इफेक्ट रहेगा, उनको ड्राइनेस ऑफ माउथ, कॉन्स्टिपेशन है ना, ड्राइनेस ऑफ माउथ, कॉन्स्टिपेशन, ब्लरिंग ऑफ विजन, यूरिन रिटेंशन, ये एडवर्स इफेक्ट भी रहेंगे. देन नेक्स्ट आता है नेपाजोडोन. नेपाजोडोन इज अ फिनाइल पिप्राजिन डेरिवेटिव, फिनाइल पिप्राजिन डेरिवेटिव. ये क्या करता है, इट विल इंक्रीज द 5:3. तो 5:3 इनहिबिटर, इट इज अ सेरोटोनिन इनहिबिटर, वीक 5:3 and noradrenaline reuptake inhibitor. It can cause nausea, dose dependent antimuscarinic action and bradycardia. Next होता है मिट्राजेपिन, is a tetracyclic है ना, piperazine, tetracyclic तो अगेन ये भी एंटागोनिस्ट होता है 5:2 को एंड 5:3 को, आल्सो हैज अ सेंट्रल अल्फा 2 ब्लॉकिंग एक्टिविटी एंड हाई एफिनिटी फॉर द हिस्टामाइन 1 रिसेप्टर, दैट्स व्हाई ये सबको ब्लॉक करता है 5:2 अल्फा 2 एंड हिस्टामाइन, दैट्स व्हाई it causes increase in the appetite and weight gain and sedation as an adverse effect. Next है rovoxetine. Rovoxetine is alpha aryl benzyl derivative of morpholine ring. Alpha aryl benzyl derivative of morpholine. So it is a selective noradrenaline reuptake inhibitor. क्वेश्चन आ चुका है इसके ऊपर. Selective noradrenaline reuptake inhibitor can cause tachycardia, dryness of mouth, constipation, sexual dysfunction. मूड स्टेबलाइजर, तो ये लिथियम कार्बोनेट जो है दैट इज यूज्ड एज अ मूड स्टेबलाइजर. तो लिथियम कार्बोनेट is included in the 1949 described the use of lithium carbonate in the mental illness. तो लिथियम कार्बोनेट जब देते हैं मैनिक डिप्रेसिव साइकोसिस में एज अ मूड स्टेबलाइजर, तो लिथियम कार्बोनेट इज यूज्ड इन द मैनिक डिप्रेसिव साइकोसिस एज अ मूड स्टेबलाइजर, है ना, बट इट विल टेक अ टाइम टू शो द एक्शन. मतलब लिथियम कार्बोनेट will not show its pharmacological action immediately, but it will take a time, right? So clear mechanism of action of lithium carbonate is not known, but ये mechanism क्या होता है, so it inhibit the phospholipase C, है ना, and ये कुछ बुक्स में दिया है it inhibit the phospholipase C and which decreases the inositol 3-phosphate and DAG in the brain, which decreases the activity, it decreases the sensitivity of neurotransmitter. कुछ बुक्स में कह दिया है it is a inhibitor of phospholipase, it is inhibitor of inositol phosphate 1. It is a inhibitor of inositol phosphate 1 and that's why prevent the generation of inositol phosphate 3 and DAG. मतलब सेम ही है उसका, बट यहाँ पे थोड़ा ब्रॉड दिया है, वहाँ पे थोड़ा स्पेसिफिक दिया है. Okay, also modify the GABA action, concentration of GABA in the brain, decreases the synthesis of noradrenaline and dopamine, also decreases the function of brain's protein kinase enzyme. So that is the mechanism of action. ADM में देखो, it is a well absorbed, okay, absorption will decrease the sodium reabsorption tubers in the kidney. मतलब क्या है, lithium carbonate will decrease the sodium reabsorption in the tubers of kidney. So hyponatremia will be the adverse. So, that's why important to it is important to maintain the adequate salt and water intake. Important to maintain adequate salt and water intake while lithium treatment. Okay? Lithium is a drug of choice. It is a drug of choice in an acute attack of mania as a mood stabilizer. You can see the mechanism of action of your lithium carbonate. जैसे यहाँ पे these are the receptors of what? Receptors of dopamine, GPCR receptor. Dopamine receptor एक्टिव होने के बाद में क्या करता है, it will interact with the dopamine receptor which are GPCR and there is a generation of secondary messengers like GTB. Then there is a inhibition of phospholipase C, and phospholipase C, there is activation of phospholipase C which will break down the inositol 3-phosphate, okay, into inositol phosphate and increase in the calcium level which causes the stimulatory response. Now lithium क्या करता है, now this inositol phosphate is converted to inositol, then inositol pyrophosphate and then inositol diphosphate, monophosphate and diphosphate, right? Now lithium will block this step, So inositol phosphate is not converted into inositol or inositol pyrophosphate or inositol diphosphate. So this cycle is prevented by this lithium carbonate because of the blocking of this step. That's how decreases the maniac attack. So proposed mechanism of action of lithium carbonate, phosphatidyl inositol phosphate, है ना. आपको मालूम है PIP मतलब phosphatidyl inositol phosphate, PIP2 मतलब phosphatidyl PIP2 मतलब phosphatidyl inositol diphosphate, IP3 मतलब inositol 3-phosphate. Adverse reactions are very important ये रख के. So this lithium carbonate is a narrow therapeutic index drug. याद रखना है, it is a narrow therapeutic index drug or narrow therapeutic window drug, and that's why therapeutic drug monitoring is required. Therapeutic drug monitoring मतलब क्या है? TDM, therapeutic drug monitoring, TDM. नहीं तो बोलेंगे आप ट्रैक्टर ड्राइवर ऑफ महिंद्रा. TDM मतलब क्या है? थेरापेटिक ड्रग मॉनिटरिंग. नहीं तो क्या, ट्रैक्टर ड्राइवर ऑफ महिंद्रा नहीं. TDM मतलब क्या, ट्रैक्टर ड्राइवर ऑफ महिंद्रा. पिक्चर आया ना नया मराठी में, यहाँ पे एक नया फिल्म आया TDM, ट्रैक्टर ड्राइवर ऑफ महिंद्रा. TDM मतलब क्या, थेरापेटिक ड्रग मॉनिटरिंग. ठीक है. तो this is a narrow therapeutic window drug, and that's why TDM is required. And mild toxicity can cause diarrhea, vomiting, drowsiness, muscular weakness, tremors, ataxia, can cause cardiac arrhythmia, allergic reaction along with the blurring of vision, glycosuria and polyuria. Large dose of lithium carbonate can cause cerebellar ataxia. Lithium carbonate can cause cerebellar ataxia in epileptic form, hypertension, coma, and then death. Chronic administration of this lithium carbonate can cause goiter, hypothyroidism, and abnormal ECG. मतलब no. Also remember, it is a teratogenic in nature. Lithium carbonate is a teratogenic in nature, so it cannot be used in the pneumonia. It can cause Epstein anomaly. Epstein anomaly क्या होता है? It is a defect in the wall of your heart. Can cause Epstein anomaly. आपका जो हार्ट का वॉल है वो डिफेक्टिव बनेगा, है ना. Lithium should be administered under supervision of the physician and needs a therapeutic monitoring. इसकी यूजेस क्या है? therapeutic use of lithium carbonate. It is used to prevent the occurrence of mania and depressive episodes in a bipolar disorder. It is a drug of choice in the prevention of bipolar disorder. So lithium carbonate is a drug of choice in the prophylaxis of bipolar disorder. याद रखना है. Lithium carbonate is a drug of choice in the prophylaxis of bipolar disorder. Also used to treat the episodes of mania, to treat the alcohol dependence. इन कुछ ड्रग्स है जैसे एंटी एपिलेप्टिक ड्रग है कार्बामाइज़ेपिन. कार्बामाइज़ेपिन is alternative drug for the lithium treatment in manic depressive psychosis. Sodium valproate, lamotrigine, gabapentin, ये जो एंटी एपिलेप्टिक ड्रग है, they are also used as adjuvant or add-on drug in the treatment of lithium resistance, treatment of mania. मतलब क्या कि लिथियम का अगर रेजिस्टेंस हो गया, वो पेशेंट लिथियम कार्बोनेट को रिएक्ट नहीं कर रहा है, तो उसमें लैमोट्रिग्निन, गाबापेंटिन एंड सोडियम वैल्प्रोएट देना है एज एडजुवेंट. तो tomorrow again we'll see some important drugs and their summary. एक दो टेबल बना के मैं कल यहाँ पे आपको ये डिप्रेशन के बारे में और बाद में देखेंगे. we'll see the neurodegenerative disorders. जो neurodegenerative disorders है वो कल देखेंगे, neurodegenerative disorders. And after that we'll see the drug used in the Parkinsonism. So I hope you have understood today's session. अगर समझ में आया तो यस लिखिए, and we'll see you tomorrow. ये सब पार्ट इंपॉर्टेंट है. बच्चे लेक्चर नहीं कर रहे, आई डोंट नो व्हाई, बट ये पार्ट बहुत ही ज़्यादा इंपॉर्टेंट है. इसके ऊपर बहुत सारे क्वेश्चन आएंगे आपको. क्लासिफिकेशन, मैकेनिज्म, एडवर्स इफेक्ट, इंडिकेशन, कॉन्ट्रा इंडिकेशन. सी यू टुमारो. सभी लोग लेक्चर करते जाओ, है ना, एक रिक्वेस्ट है आपसे। क्योंकि क्या होता है कि इनिशियली जब जीपैट का लेक्चर ज्वाइन करते हो तो इनिशियली लॉट ऑफ पीपल दे यूज्ड टू ज्वाइन द लेक्चर्स एंड इनिशियली उनका इंटरेस्ट होता है, बाद में क्या होता है कि उनको थोड़ा सा इंटरेस्ट कम हो जाता है उनका, right? तो कंसिस्टेंसी इज वेरी इंपॉर्टेंट इन एवरी वर्क। तो हर एक चीज में आपका कंसिस्टेंसी इंपॉर्टेंट है ना। आज जिम गए, है ना, किसी ने अगर मोटिवेट किया है कि जिम जाना चाहिए तो मोटिवेट होकर जिम में चले गए, है ना, एक दिन गए, 2 दिन गए, 3 दिन गए, बाद में जिम बंद कर दी, दैट शुड नॉट। वो कैसे करेगा आपकी बॉडी? अगर आपको बॉडी बनाना है तो जिम में कंसिस्टेंटली जाना पड़ेगा, कंसिस्टेंटली हार्डवर्क करना पड़ेगा, तभी जाएगा, है ना। तो अचानक ही नहीं सब कुछ होता है। मुझे भी जो आता आ रहा है, जो भी मैं पढ़ा रहा हूँ, जो भी लोग मुझे बुलाते हैं, ये अचानक थोड़ी प्रकट हुआ है, मुझे ऐसा कुछ साक्षात्कार थोड़ी हुआ है। मैंने उतना पढ़ाई किया है, मैंने उतना उतना टाइम दे दिया है, उसको कंसिस्टेंटली पढ़ा है, तब जाके ये मिलता है। ऐसा नहीं, इजी नहीं है। बहुत सारे, है ना, करोड़ों में पड़े हैं एम.फार्म के, जॉब नहीं उनको, ना उनको कोई कोई सुनता है। तो कंसिस्टेंसी इज द की ऑफ सक्सेस। कंसिस्टेंसी इज द की ऑफ सक्सेस।